I know we've got several attendees that have just been sort of waiting in the sidelines, and so we want to give them a chance to for their computers to connect here with us. If you're watching this on YouTube or Facebook or somewhere else, we want to encourage you to join us live, because the benefit of joining us live is that you get to actually speak with our host and ask questions of our host, Dr. Scott Saunders, who is joining me today. By the way, my name is Kevin Gullickson. Normally you would see Joe Barton sitting here. He's kind of hovering in the background right now, just kind of listening in today. And I am jumping in. There's Joe. Hey, Joe. I am jumping in because this is actually a topic that I find quite fascinating. And so everybody was like, well, Kevin, you need to ask the questions then. So I'm here with Dr. Scott. Good morning, Dr. Scott. How are you doing?
Good morning, Kevin. Great, great. It's a great day in California.
Excellent. So many of you have gotten to know Dr. Scott now. Dr. Scott Saunders, MD. He is a doctor of integrative medicine, and he's out of Santa Barbara, California. And Dr. Scott, I was just thinking about this. I was thinking about the diversity of the people that you have worked with in your practice. And I just think it's really phenomenal. You've worked with people of all ages, all races, even a celebrity. I won't mention any names, but I know you've had a lot of background, and we really appreciate that because there's so much wisdom, I think, that you bring from your practice through the years and through working with so many over those years. And so I just have to say, every time that I get a chance to sit down with you, I love it because I just feel like I'm drinking from the fountain of health wisdom. So I just want to say thank you to you and what you do. And I know as a doctor, your mission, you desire to absolutely help people to find a place of wholeness in their lives. And so I just want to say thank you for that. Very, very much.
Thanks. So, yeah, that's what I love doing. I love knowledge, and I love learning, and I love imparting that knowledge. So, and I try to look for truth and not just get caught up in everybody's opinions, which there are many.
And so many times today, I think when we think of doctor's visits, right, we think of going in and spending a very short amount of not necessarily quality time with our doctor because they've got a lot of people that they get to see. And one of the things that I appreciate about you as well is your desire not just to treat symptoms, but to really discover, what is the root? Where is this coming from? What is the problem? And that's really important, isn't it? And
that's key. That's actually the key.
Yeah. So the topic that we're going to talk about today, just really an interesting one. I think it's kind of a newer area of study. I mean, people have been looking into the topic for a while, but I think we're just coming to a place where we're beginning to understand how this works. And it's a topic called epigenetics. And so stick with us for a while, you guys. We're going to explain what this is and what it means to you. But this is why it's important, because we have been told a lot of times that our genes really determine who we are. And epigenetics and talking about this is going to maybe challenge that thought a little bit. So before we get started, let me ask you a question, Dr. Scott. I am curious because type 2 diabetes is obviously our main topic on this webinar from week to week. So my first question for you is type 2 diabetes genetic?
Oh, absolutely. There's a genetic component. Some people can completely live on carbs and eat whatever they want and not have any issues. And you can see whole groups of people, tribes or ethnic backgrounds, people with, if you go to Southeast, the islands in the South Pacific, for example, or certain tribes of American Indians, and they are so good at storing and holding on to calories and and storing carbohydrates and turning it into fat, that that if they eat every day, they're going to get diabetes. It's like the Pima tribe in Arizona, 80% of them, that means 8 out of 10 are going to get type 2 diabetes.
Wow.
In their lifetime. So, you know, whereas if you take many Northern Europeans, for example, that you have very few, 10 to 20% might in their lifetime. So it's not, there is a genetic component, definitely.
Okay, gotcha. Well, that leads then to kind of a very important question, and really what I want to hone in on today is, do your genes then control your destiny?
See, that's the next question. And the answer to that is like the dogma of genes determine destiny. That's like for the last 50 years plus, they've been teaching us that in school, that, hey, there's nothing you can do, you know, it's in your genes. And that's actually not true at all. Like the genes, like the genetics is a map. It determines what you could be and what could happen to you. And it determines your possibilities. And then all the rest is epigenetics. All the rest is what you put on it. Let's take, for example, the that Pima tribe in Arizona. They have cousins that are genetically the same, essentially, across the border in Mexico. And the Mexican government doesn't help them out at all. They have to grow all their own food. They have to run from village to village. They don't have any transportation. They don't even have car. Well, now they do, but 20 years ago when they didn't, it was a totally different picture. These same genes in this same, essentially same group of people, on one side of the border, they're getting a lot of help from the government, and they're getting a lot of food, and they're eating American food, and they're eating processed food and drinking Cokes. And in Mexico, they're growing all their own food, you know, so everything comes out of the ground for them. And so you have no cases of diabetes with the same genes as the people with 80% diabetes.
Okay.
And that's epigenetics. That's a beautiful example of epigenetics.
So really, so over the border, the propensity is still there for diabetes, and that the genes are still there, where if the environment is right, then the chance of them having diabetes is greater as well. But because of the environment and the different lifestyle, one tribe, or one part of the tribe has higher prevalence and the other doesn't then.
Exactly, just because of their different lifestyle. That's epigenetics.
Okay, so let's talk about this word, epigenetics, kind of a fancy word, but what is it? What does it mean?
Okay, so so genetics is the DNA. That is what every cell in your body has to map out who you are and what you are, what proteins you make. There's over 20,000 different proteins are coded in this DNA, and it's all it does is one thing: it codes proteins, period. But that's all your enzymes that determine the reactions in your body. And all of that determines like what color your eyes are, how big your nose is, and all of that. But even those characteristics, if you take people who are identical twins, there are certain things that, you know, they have a lot of similarities, and everybody goes, "Wow, you guys are very similar. Are you twins?" And they are, and because they have the same genetic material, but they are what changes or what becomes different is their epigenetics. So if they're raised in a different environment, certain things stay the same and other things change. And so there are definitely genetic effects, and then there's epigenetics, and epi means on top of or beside or in addition to. So besides the genes, which determine a lot of what you are, what proteins you make, what enzymes you make, there's the epigenetic, which, and here's the key, turns on or off genes. So, so the epigenetics is something really important that in nutrition we call methylation. And methylation, a methyl group, if you've ever seen it, is just one carbon atom with 4 hydrogens around it. Well, 3 hydrogens. And that methyl, that one carbon is added on to turn off a gene, or taken off to turn on a gene, or to regulate the genes. This is done by methylation. And so you have certain vitamins, for example, the vitamin B12, folic acid, S-adenosylmethionine. There are certain substances in our nutrients that we get that are able to attach your genes and say, turn that one off, and then turn that one on. And so it's one thing to have the gene, it's another thing to have it turned on. And what's really weird is this, that if a mother, for example, when she's pregnant, has certain genes turned on, then the fetus will also have those genes turned on.
Wow.
So a lot of these studies in rats and mice, where they, during pregnancy, they have the rats who have a genetic tendency to diabetes, but during pregnancy, the mom does not eat any carbohydrates. Those rats do not get diabetes later on in life, no matter what they eat.
Wow. Wow, that is very fascinating. So I'm trying
Isn't that amazing?
We've talked about a lot of science here, and I'm trying to think of a way to kind of understand it, you know, from my perspective. So as you were talking about it, I was thinking about
that's why you're here.
Yeah, I was thinking a lot about just my family and our house, and like sometimes I go around the house and I'm like, why did they leave this light on? Like I you're talking about switching things on and off, right? And I'm thinking about like these light switches throughout our house, and or how about this? How about it sounds like a photocopy machine, right? Because that's what's happening with our genetics, right? Is the DNA is getting copied, and is that creating cells? Is that how we understand it?
Yes, it's creating cells, but at the same time, the part of the copy is what is on and what is off. So some of the genes have like a methyl group attached to them, turning them off. So for example, in a genetic tendency, like a family tendency to get cancer, it's not the presence of the gene, it's that certain genes, regulatory genes, are turned off, or in some cases on, to create family history of cancer. So gosh, everybody in my family gets colon cancer. Well, why? Because this regulatory gene in the colon enzyme is turned on too much or turned off too much to that allows cancer cells to grow. They call it like familial polyposis. Does that make sense?
Yeah, absolutely. So, so as we're talking about this, obviously our focus here is on type 2 diabetes. So how is type 2 diabetes influenced or affected by epigenetics?
Oh yes, oh yes. Okay, so and this can be done immediately. So when people go on, one of the reasons we developed this program is when people go on the, when they get the diabetes solution kit and they start on phase 1. Phase 1 is all about epigenetics. That's what you're doing. You're turning on certain, it's called chromatin, certain genes that allow you to burn fat Whereas people who eat carbohydrates every day on a regular basis lose the ability because the genes that burn fat are turned off. So what you're doing really in the phase 1 of the diabetes reversal program is to turn back on those genes that allow you to burn fat so that you can switch from fat burning to carbohydrate burning to fat burning to carbohydrate burning easily and not use up your proteins for energy. It's all about epigenetics, and that's been proven in studies that you're actually turning on the genes by your diet. The diet does that.
Gotcha. And just to highlight what you said, the program that you're referring to, of course, is the Diabetes Solution Kit. And for those of you that maybe have joined us, I think a number of you probably have already gotten the Diabetes Solution Kit and read through that, started the 3-phase plan. But if you haven't, please visit our website. It's bartonwebinar.com. And that's where you can find out more information on the Diabetes Solution Kit, as well as some supplements that really help with type 2 diabetes. I've got a couple of them right here. Synachroma and Nervala are 2 that you'll see there. And in fact, we do have a coupon for these. For those of you that have joined the webinar, it's Barton10 webinar 10 is the coupon code, and that will give you $10 off of these supplements. So just wanted to mention that while you had kind of mentioned the program there. So one question I've had as we've been talking about this is, so what are the environmental factors that that affect turning the genes off?
Okay, that's a huge question, but to simplify it as much as possible, remember I talked about methylation, where the enzymes add a methyl group onto the DNA to turn it off, for example. You have to have enough methyl groups, and that is vitamins. So if you don't have enough vitamins, you won't be able to regulate your genes very well. That's why having low vitamins predisposes you to getting things like diabetes and even cancer and things like that. So that's one environmental factor that's really important. You have to have enough nutrition. Vitamin B12 is a methylator, and it's a very common deficiency. And the reason it's common deficiency is because we commonly, because we eat too much, because we have intestinal problems. This is a difficult vitamin to absorb. You only have 18 inches in your bowels where you can absorb vitamin B12. And if your stomach isn't making intrinsic factor, you're not going to get it. And if it rushes by there because you have diarrhea or irritable bowel syndrome or inflammatory bowel disease or something going on, you're not going to get vitamin B12. So it's a very common deficiency. I usually recommend people, especially get an adequate amount of vitamin. Requires supplementation to some extent, at least. My patients, when they come in with things like diabetes, neuropathy, I give them shots of vitamin B12 just to start. Just go. I'm not even going to measure your level. I'm just going to give you a shot of vitamin B12 because you have symptoms.
Sure.
Another one is folic acid. You have a question?
No, go ahead.
Okay. So another one is folic acid. Folate is folic acid is not useful to us. We can't use it until it's been activated. And a lot of people, a good 10% of the population doesn't activate the folic acid very efficiently. So then they don't have enough methylation, so they don't regulate their genes very well. So sometimes supplementation with an activated folic acid, which is called methylfolate, that's the methyl group, that's the one thing we were talking about, is something that's very helpful for having sufficient of that. sometimes you can get like one supplement that has all of the methylation, activation methylation vitamins in it. So one of the factors that you mentioned is nutrition. Another factor is your thoughts. What you're thinking changes your genes. Now you can do that yourself. Just do an experiment and sit here and think back to the most stressful thing you ever had in your life. And I don't know, what is it? Going through a divorce, the death of a loved one, having a lawsuit, sitting in court. I don't know, something that was extremely stressful, and put yourself in that situation. What happens? Well, your heart starts beating fast. Your blood pressure goes up. You start sweating in your armpits and your palms. Why does all that happen? Well, it's because you've just changed your genes by your thoughts. All you had to do is think about it, and you changed the production of hormones like epinephrine, adrenaline, and other stress hormones just by thinking about it. And so when people have chronically stressful thoughts, they also produce a lot of these stress hormones, and guess what they do? They cause diabetes. Now, can I give you an example of that?
Yeah, absolutely.
Okay, so Julie was overweight. She was over 200 pounds, not extremely overweight, but overweight, and she had diabetes. And so she was coming in to see me on a regular basis, and we could not control her blood sugar. It was like so frustrating because I gave her drugs, they weren't working. And we tried diet things, and she's drinking Diet Coke, and she says, no, there's no calories in it. I'm going to keep drinking it. So she keeps drinking it. And her blood sugar was not coming down. I sent her to a diabetes specialist, like the premier Dr. Jovanovich, the greatest diabetes specialist in the world. And she came back on 200 units of insulin injections and 3 medications. And she was still not controlled. Her blood sugar is always 200s in the 200s, always, no matter what.
Wow.
Then one day she called me and she says, oh, I feel horrible. I said, what's your blood sugar? She said, 50. And I'm like, oh my gosh, stop the insulin, drink some orange juice, get off the medication. What happened? What did you do? Nothing. I swear I didn't do anything. Are you still drinking your Diet Coke? Yeah, I still drink. And your diet hasn't changed? No. What about exercise? No. So she came in to see me. We could not figure out what happened. Mentioned something. Her daughter had moved out of the house. Her teenage daughter. Well, now she's like 20. But while her daughter was in the house, they were fighting constantly. It was a battle, constant battle. When they weren't battling, her daughter was running away from home, and she's like, oh, my daughter. Oh, it was always a stressful thing to have her daughter in the house. Well, then her daughter moves out into her own apartment, and all of a sudden they're best friends. She calls, hi, Mom, how you doing? They're like best friends. All of the stress went away, and her diabetes, she had no diabetes anymore. Her blood sugars were totally normal with no drugs, no insulin, nothing.
Man, that is a big deal, and something for us definitely to highlight. I listened to the Brain Warriors Way podcast, Dr. Daniel Amen, who's one of the top psychiatrists in the nation. And he does a lot of brain spec imaging. So they look at people's brains and the things that affect people's brains, right? And he talks about, he calls them ants, automatic negative thoughts. Those things that we think about that just kind of keep coming back, like, oh, I'm not good enough, and oh, that person doesn't like me, and all these kind of things that are just kind of those default negative thoughts. And they look at the brain and they see how it physically changes, how our thoughts physically change the brain. And that's always been really, really fascinating to me. And it sounds like then it's amazing how then those thoughts and that effect on the body then can lead to, these chronic diseases and other things. as a result of that stress and the negative thoughts and what it's physically doing to us. That's pretty fascinating.
Well, and diabetes. I mean, that's our subject here, diabetes. And stress is a huge factor. You can't, ignore that. You can't just say, I'm going to eat a good diet and still be all a stress bucket.
Right.
Might be counterproductive.
And stress is probably not one of those things that our doctor is really going to think about talking to us about, right? Like they're going to look at the symptoms and they might talk about nutrition, but mostly they're going to give us a medication, here's what you need. But we have to look at the whole person, right? And look at every part of us that is affecting the whole of who we are, and treat ourselves well, right? So are there any other factors like, hey Joe, did you have something to chime in on?
Yeah, I thought we could talk a little bit more about stress relief. And I was just thinking about the importance of community and having people like a support group and people that are supporting, the new decisions that you're making. Because a lot of times this whole subject of epigenetics is talking about nature versus nurture. And a lot of times your surroundings, it's like a drug user. If you, are addicted to cocaine and you get thrown in prison and then you get clean, and everything is going pretty well, but then you get out of prison and you go back into the environment that you were in before, high likelihood that you're going to get back into your cocaine addiction just because of all the familiar surroundings and temptations that you have. However, if you get out of prison and go to a completely different world where there is no, the environment is different, so the same principle, I think, comes into effect with our eating and our diabetes and things like that and our health. And so I think it's important to just remember that information that we're learning from Dr. Saunders in the Diabetes Solution Kit, all of that is like, it's changing the information that we're feeding ourselves, but we also need to have that community aspect which I think this webinar is helpful for. People are seeing and that's one way to do it, but also just finding like a support group locally and just like intentionally getting yourself out of the environment that causes you to make bad decisions. And that can be emptying your pantry of bad carbohydrates and your refrigerator, things like that. So Dr. Saunders, if you have a patient that comes to you and you know that they're in a tough environment, what do you tell them to do?
Joe, that is so important, and I can't emphasize that enough. And it's so hard too. I've had cases of like a woman who was very overweight, over 250 pounds, had diabetes, and not feel good, and and had diabetes and was not functioning very well. And so I put her on program, a low carbohydrate, just like the diabetes reversal program that we have. And she started doing pretty well. She lost about 10 pounds. And then her family started saying, oh, no, you're losing weight. You can't do that. And started forcing her to eat. They would not let her lose weight. It was really important to them because in their culture, if you lose weight,
we lost
him
here. But while we're waiting for Dr. Scott to jump back on, I'm so glad that you brought this up, Joe, because probably this is there we are. Hey, Dr. Scott.
Scott, we lost you for a little bit. Scott, we lost you for the last 20 seconds or so, and your video isn't working right now. But we can hear you.
Okay. So where did you lose?
Right now. So
what was the?
Maybe Scott, if you want to turn, can you turn your video off, Scott? Because that'll probably help your connection so that we can hear your audio. We love to see your face, but we don't have to necessarily.
Okay. How's that? Is that better? You don't.
I can still
my
see your
face.
video. Yeah, can you turn your, there you go.
There we go.
I think that will
Okay.
help. So,
Hmm.
yeah,
Okay.
we heard, you were talking about the environment, that their family, really wouldn't allow her to lose weight. It was just, yeah, ingrained in
Yeah.
his family.
Yeah. So people, they go back into their culture, their environment, and everything about. Can you hear me now?
Yep.
Yeah. Okay. So everything about how they got there in the first place has to change somehow. And so what I found is it's so important to get family members on board. So I always, when I start somebody on a program, when I'm going over their test results and things, I always have their significant other come in, and family if possible, anybody who's helping take care of them, to bring them all in to get everybody on board. Because if everybody isn't on board, then they can totally undermine everything that you're trying to do for them. So that's really important. And the other thing is exactly what Joe said, and that was really good, is to change all of the stuff about the food that you eat. So taking everything out. And I've actually done that once. I had a patient that said, well, I don't have anything in my house that I can eat. So we went there with the trash can and just took everything out of her cupboard that was not on her diet, and emptied it out, and then gave her a list of things to go to the store and buy stuff. And you know,
That could be a
sometimes you
dangerous,
have to make some radical changes.
yeah, that can be dangerous if you have other people in your house that like that food and maybe don't have diabetes or whatever. But for the sake of your health, yeah, it's definitely best if everyone in the house is going to eat the same way, eat healthy and nutritious and low carb for sure.
Yeah. If I can interject, I want to kind of go back to this idea of community, Joe, that you mentioned. I mean, my full-time job is working for Barton Publishing, but my volunteer side job is I'm a pastor. And so I see people in community all the time. And I've seen so much how a community can impact a person's life for good. You know, people, all of us, we have our struggles, we have our challenges, we have our things that we're working through. And there's a proverb that says, if you walk with the wise, you will be wise. And I encourage people to find people that are where you want to be in a certain area of your life, and spend time with them and ask them questions and talk with them. How do they live their lives? How do they do what they do? And I just find that people find success when they've got somebody that they can like look to as a mentor or as a role model for where they want to be. And so I think community is vitally important in that way.
For sure, yeah. We've got a couple of questions that have come in on the Q&A section, Kevin, if you want to.
Yeah, absolutely. So it looks like we have a question from Jan. Hey, Jan, thanks for joining us this morning. It looks like you're taking some sort of a supplement. It says Blood Sugar Premier. I'm not familiar with that. Says, when is it best to take this? I took after dinner last night. My blood glucose was 96. I woke up and it was 109. What's going on? So I'm not sure. Maybe you're referring to Synachroma. I'll let Dr. Scott address it as if maybe that's what you're referring to, is the Synachroma supplement. Synachroma, by the way, it's primarily cinnamon and chromium, which are known to help to support healthy blood glucose metabolism. And it's also got chromium picolinate, vitamin D3, vitamin K2, selenium, all to support healthy blood sugar and to provide supplements that are commonly missing in our standard American diets. So Dr. Scott, can you talk a little bit about that? I mean, what if we are taking supplements or doing things to help our blood glucose, but I mean, is it possible we wouldn't see some change sometimes or right away?
Oh yeah, absolutely. So the blood sugar, I think the question is, you know, taking a supplement, and the expectation is that if you're taking it at night, whether it's Synachroma or some other one, that your blood sugar should go down overnight, and from 90 maybe to 80, 60, 70 because of the supplement. And in some cases that may help, but mostly what the supplements do is work over time and not on an immediate basis. So it's not kind of like you're taking a drug. The drugs like glipizide and glyburide will have an immediate effect because they cause the pancreas to release insulin. So they have an immediate effect on the blood sugar by dropping the blood sugar and can cause you to go too low. But the supplements don't do that. They're more like metformin. They make you more sensitive to the insulin that you already make. So your pancreas is still doing the regulation. And that's why you're not going to see blood sugar drop from taking a supplement as a rule. Chromium, for example, is part of an enzyme that allows you to use sugar more efficiently. So it doesn't like drop your blood sugar like glipizide or glyburide or
Sure.
some of the medications will.
Okay. And then we've talked in a past webinar, I think it was pretty recently, even about time of day and what happens when blood sugars are higher in the morning when you wake up and that kind of thing. So I would encourage Jan, if you want to go back and listen to some of the past webinars as well. Joe, do you remember which one that was? Was that last week or the week before?
What was that? Which one?
We were talking about, blood sugars being higher in the morning and what's going on there.
It was related to stress. I don't remember which one that was. Yeah, we got into a bunch of different topics, but stress definitely. If you don't get a good night's sleep, your blood sugar in the morning will be higher for sure. So that's very interesting to me.
And by the way, if you've missed some of the past webinars, they are available on YouTube currently. I don't know if we will always have them out there for free. So I want to encourage everybody to take advantage of the ones that you've missed. When you go to YouTube, just search for Barton webinar and diabetes, and it will certainly come up when you do that. So Claire asked a question. Claire, thanks again for joining us. And you suggested maybe emailing a list of bad stuff or food. And Joe, right now, if you can see his video, is holding up the diabetes solution kit. And actually, there is a list of there's a grocery list that's a part of that that tells you exactly what you should get, what is good stuff for diabetes. So again, if you go to bartonwebinar.com, you'll see a link to the diabetes solution kit there. And
it's basically the last couple pages in the diabetes solution kit. It's pages 110 and 111. So if you just go to the download, it's called the grocery list in the back. And that will give you, that's the best way to get the list there, Claire, and anyone else. So.
And we have a newly updated diabetes solution kit, by the way. Anybody who has purchased it in the past has digital access to the new version for free. So anytime you purchase the diabetes solution kit and we upgrade it and redo it, we've just worked with Dr. Scott to make some really great upgrades, and Joe's wife, Amanda, has helped to make it more of a workbook that's more helpful to kind of work through details. If you have purchased the diabetes solution kit, you have access to that in your account. If you don't know how to access that, just reach out to our team, support@bartonpublishing.com. Cheryl will be glad to get you the link to that. So we've got a few other questions here. Jan asks, so supplements don't help drop blood sugar? So if you want to clarify that, Dr. Scott.
Oh yeah, that's well, they don't have an immediate effect at dropping blood sugar. No, as a rule, they're not going to do that. Their effect is over time to help the body become more sensitive to insulin. And in fact, more important than dropping blood sugar is dropping insulin. So when there's less insulin being produced, then you're allowed to burn more fat because insulin prevents you from burning fat. So the effect is actually secondary on the the blood sugar. So it's really not about blood sugar. It's really about dropping insulin levels so that you have, you're able to burn fat. And that's what, remember, turning on those fat burning genes. That's what helps do that. And getting enough of those nutrients is important for that.
Okay. And so this is kind of where we have to shift our thinking, right? Because, we're in a microwave culture, right? A fast food culture. We want immediate results, immediate response. And sometimes medications give us that. But what we're really talking about is we're talking about looking at our lives long-term and what's the thing that's going to give us the most long-term value. And so it sounds to me like what you're saying is supplementation is actually doing things inside of our body that our body kind of needs to be doing. Like it's giving us the nutrients for our body to function the way that it was intended to function and work. And that's where we ultimately want to go longer term.
And that's our discussion today is epigenetics, and that's exactly what the nutrients are all about. Is changing the epigenetics over time, and not just the blood sugar.
Right, absolutely. So I'm watching the time, and it looks like we maybe have time for one more question here. And Howard has joined us. Hello, Howard. He says that he was prescribed metformin, and seems to me from the program, it's not helping him to lose weight. I'm pre-diabetic and have borderline stats on my blood work. What is your opinion on metformin?
Okay, metformin can be very useful. It's important to know that metformin is not a weight loss drug. It doesn't really help you to lose weight. What it does is it blocks your body's ability to use sugar. And by doing that, it kind of forces the body to use fat. And so it can be helpful in getting started on losing weight. But that's why we have the diabetes solution kit. The first phase 1 part of the program is to turn on the fat burning genes. So while the metformin can sort of force the issue, it's only helpful to a certain extent. If your diet doesn't change, if the epigenetics doesn't change, then the metformin isn't going to make all the difference. It can be helpful in a similar way to what we were just talking about with the supplements. Metformin doesn't lower blood sugar specifically. Secondarily, it can, but not primarily. In the same way the supplements work. So by making you more able to burn fat, then it can be very helpful in the case of if you're doing the diabetes solution kit. The metformin can be very useful, but all by itself, it's not going to change your epigenetics.
Okay, great. Thank you for that.
Kevin,
Dr. Scott?
There's a couple more questions related to this in the chat. One is about metformin XL and vitamin B12 absorption, and then another one about Trulicity. If we could quick get to those,
All right,
that'd be great.
You bet. I don't see the one about absorption.
I can read it. So
yep.
Yeah, this came in from an email that Leslie shared. So it was reported that type 2 diabetes subjects who take metformin XL restricts or knocks off vitamin B12 absorption, necessitating intake of sublingual B12 tablets. Can you further comment on this?
Yeah. Okay. So anything that prevents the stomach from making intrinsic factor can do that. So it's not just metformin. Metformin is one thing, but there are others like omeprazole and antacids that people take that prevent the stomach from making intrinsic factor, so you don't absorb vitamin B12. That's why I said vitamin B12 is a very common deficiency, and that's why almost everybody who comes in, especially if they have neuropathy or something, I give them vitamin B12 as a shot to start off with. Okay, now the sublingual vitamin B12. Very tiny amounts are absorbed sublingually. It turns out vitamin B12 is a huge molecule and is not absorbed very easily from anything. So they make a cream, vitamin B12 cream to absorb through the skin. And you can get tiny amounts that way, microgram quantities. But you're not going to get the full amount except in those like 18 inches of the terminal ileum where it's supposed to be absorbed. That's why the metformin can affect the vitamin B12 absorption, but the sublingual can be somewhat helpful. There's no good way around that. Yes, when you take the supplement, a tiny amount is absorbed sublingually, and the rest of it goes down into your intestines, and you absorb it normally if you can. Again, another small amount. So there is inhibition. Yes, that's.
And real quick, so I had to Google what does sublingual mean. That basically means taking it under the tongue or in your mouth, right?
Right. Yeah. You hold it in your mouth under your tongue. And there's veins that are very close to the surface under the tongue, and so you can absorb certain things easily that can be absorbed that way. There are certain things, especially fat soluble things like steroid hormones and stuff like that you can absorb under the tongue pretty easily.
Okay. And then we had this one last question about synochroma and metformin. Kevin, you want to ask that one? And then
absolutely.
Wrap it up.
So Henry is asking, is it helpful to take metformin at the same time as synochroma? And I do want to throw in, of course, we want to encourage everybody. This is, we're giving opinions here. And we want you to talk to your doctor about these types of things as well. But Dr. Scott, do you want to address that there?
Yeah, you can take it at the same time, and they're not by themselves. They're not exclusive by any means. And yeah, you can take metformin with food. You can take synochroma with food. In fact, taking synochroma in the morning with breakfast, there's a reason we say that is because the benefits are greater by taking it in the morning. That's a really interesting new study also. We should probably do a webinar on this about taking your supplements, vitamins, even food in the morning is different. You get different absorption, different utilization than if you take it at night. So there's a reason we have it in the morning. And metformin is often taken twice a day unless it's the XL. And anyway, so yeah, that's they can be taken at the same time.
Okay, awesome. And just want to remind everybody, if you go to bartonwebinar.com, the link is in the chat, and you can get today $10 off of synochroma by using the coupon webinar10. And I believe that's in the chat as well. So I want to encourage you to take advantage of that while you have the opportunity, again, at bartonwebinar.com. And also want to mention too that Dr. Scott is a regular contributor to our monthly online magazine called Home Cures That Work, and want to encourage you to check it out. There is a link to that on the page as well. But if you go to homecuresthatwork.com, you'll see a lot of articles by Dr. Scott. And I don't know about you, but I can't get enough of Dr. Scott. So I like to go check him out all the time. And there are actually several articles on there that are on our topic today of epigenetics. So if you just type in the search, whatever you're interested in relating to lots of topics, not just diabetes, lots of natural health topics, you'll find just about anything there that you want to know about. If there's some topic that you don't find there, let us know. And Cheryl, who's our editor, will probably do a monthly magazine on that topic. So encourage you to check that out as well. Such great information that you'll find there. So, all right. I think we've got a few other questions, but I apologize, you guys. I think we're going to hold off until next week just for the sake of time. But some great questions. And Leslie will capture those, and we will make sure that we bring up those topics again next week for you. So thank you guys for joining us so much. Thank you, Dr. Scott. Do you have a joke to leave us with this morning?
Yeah, okay. So there's these cousins, Mary and Terry. And Mary and Terry they're best friends, and they do everything together. And it was Mary's birthday, so they go and they decide that they're going to go to the county fair. And so they go to the county fair, and they're having a great time. And they eat and everything. It's a really hot day, and they're going on all the rides. They're just running from one ride to the other to the other. They go on the roller coaster up and down, and they have a great time. They're going on the Ferris wheel, and it's a super hot day, and they're super thirsty. And so they go and they just want a drink. So they go and they see lemonade. So they walk over to the lemonade stand, and there's a whole bunch of people waiting for lemonade. And they're like, oh man, it's going to take us an hour to get through all these people. And so they hear about, somebody says, well, over on the other side of the park, they're serving punch. And they go, oh, I'd rather go there. So they walk all the way across, like they're super thirsty, and they get there, and it's a miracle. There was no punchline.
Oh man.